Before we start today's episode, I would like to quickly read you our podcast disclaimer. The content in this podcast is for general reference and educational purposes only. It is not meant to be complete or exhaustive or to be applicable to any specific individual's medical condition. No information provided in this podcast constitutes medical advice and is not an attempt to practice medicine or to provide specific medical advice, diagnosis, or treatment. This podcast does not create a physician-patient relationship and is not a substitute for professional medical advice, diagnosis, or treatment. Please do not rely on this podcast for emergency medical treatment. Remember that everyone is different, so make sure you consult your own healthcare professional before seeking any new treatment and before you alter, suspend, or initiate a new change in your routine. Welcome to The Starting Gate. We're your hosts, Dr. Kitty Dotson
and Dr. Sarah Sheets,
two internal medicine doctors who spent years practicing traditional primary care. Over time, we realized something was missing from modern healthcare. A real understanding of how everyday lifestyle choices impact overall health.
We'll help you cut through the noise of the countless health influencers and their conflicting opinions. Because no matter who you follow, the basics of lifestyle medicine are at the heart of it all.
Welcome back to The Starting Gate. We're your hosts, Dr. Kitty Dotson
and Dr. Sarah Sheets.
So as lifestyle medicine physicians, we know that the basic foundations of health are very powerful, especially when you can be consistent with them. Things like eating whole foods, moving regularly, managing your stress, getting good sleep. But where does personalization fit in? Because that's something that we just recommend to everyone. So precision medicine is a term that I feel like is coming up more and more often. And it's one of those phrases that's exciting, but also I think a little intimidating, especially when you're thinking about DNA. And I know I wonder, and I think everybody kind of wonders what their DNA is holding for them. But we want to talk today about really understanding what's the science behind some of these DNA tests that we're seeing out there, what's the promise, and what are the limitations of precision medicine as far as how it can help us with our health long term.
So today we're going to explore exactly what is precision medicine, what kind of information genetic testing provides, how much these recommendations actually differ from person to person, because sometimes it may be larger than we think, and sometimes it may not be very different at all, and whether most of us actually need genetic testing to live a healthy life. So Kitty and I are not experts in this, so we brought in Dr. Meghan Jones, who is an expert in precision medicine. She helps patients use these genetic tests, lab data, microbiome analysis, and other biomarkers to develop a very individualized lifestyle plan. So thank you for joining us today.
Yeah, thanks for having me.
And can you give our listeners a little bit of information of how you came into precision medicine?
Yeah, so my background was in emergency medicine, the other end of the spectrum, and had some friends that kind of pulled me into this space, told me what they were doing with genetic data, personalized data. And around the time, like my kind of family history, my dad had struggled a lot with heart disease, ended up passing away from multiple rounds of stents and surgery and heart transplant and all that. So it came at a time that I was very interested much more in the preventative side of things and just wanting to help from a different angle.
So really in learning about prevention for yourself, you came across precision medicine, wanting to know what your DNA
absolutely
held for you. So can you tell us just a little bit, what is precision medicine?
Yeah, I think the simplified down version is just gathering as many forms of data we can on a patient, whether that's genetics or their biomarkers or microbiome, but also lifestyle and their family history and their environment, and using all that information to really tailor an approach to optimizing health, to preventing chronic disease, looking at longevity, just making it as tailored as we can.
Is it mostly in thinking about prevention, or is this helpful for people that have chronic disease as far as their treatment goes?
Yeah, I think a lot of folks I've often worked with come in with trying to optimize and prevent, but I think there's definitely a role that this plays in treatment. And I think historically a lot of precision medicine started more so in treatment, right? Looking at genetics of tumors and different cancers and all of that, but can definitely use some of these things to help optimize the best treatment course for somebody that already has a chronic disease.
And I know the word longevity medicine has also become very popular. How do these coincide? Are they similar? And how should a patient look at some of this information if they're trying to just live their longest, healthiest life?
Yeah, I think definitely from the optimization and prevention standpoint, we want to live as many years as we can, but definitely live as many good years as we can. And so if we're staving off chronic disease for as long as possible because we've gotten to implement some very tailored, specific things that's going to help your body function as well as it can, that's going to roll into that longevity piece or increased health span piece. Just a way that you can hone in and narrow it down versus getting bombarded with all this information. There's so many things that sound like they're right for everybody, but may or may not work for you based on your tailored, precise information.
You mentioned gathering data from a lot of different sources to get a picture about a patient. So tell me a little bit about what would that look like? So if a patient was interested and said, yes, I want a good precision medicine evaluation, is it blood work? Is it, what all does that entail?
Are you going to ask me for my poop?
Yeah.
Do you want my poop?
Maybe. Depends on your goals. Yeah. Depending on your goals. Yeah, but that, I think starting off, it just looks like taking a really deep, in-depth health history, right? Whether family history, personal history, what are your goals? Is there a specific symptom or concern you've been living with? Maybe that includes gut health, right? And so we might get to the stool sample. But from the beginning, a lot of precision medicine is likely going to include some genetic testing and not looking for specific genetic diseases, but just these DNA variants that can change how your genes might function, how efficiently they work, and how we can work with those. So that's usually going to include some type of either like a spit test, or you can get them with blood work too. And then layering in things like biomarkers, maybe those are more in-depth metabolic markers, inflammatory markers on labs. So blood work in that sense. Certainly it might include a stool test if we're getting big sources of inflammation, if you have specific gut health concerns. And maybe that includes, we incorporate some of your wearable data, like your heart rate variability strap, your sleep tracker. Yeah, you get to start with kind of big picture blood work, lots of things, and then narrow it down into different rabbit holes depending on your goals and specific symptoms and concerns.
So maybe just to help us understand, we could just talk through a patient that was coming in, let's say just for, they felt fine, nothing in particular, but they just wanted to optimize health and longevity. And so we're coming to see you and just ready to do all the things. Maybe we could go through what that data might show for them in each of the buckets and talk about what that means.
You know, somebody that doesn't have major concerns, otherwise healthy, we're going to work through based on our pillars of health. So like nutrition, exercise, sleep, stress reduction. And say we had genetic data for that, we might look through starting with macronutrients. How do you metabolize fats and carbohydrates?
And so what does that mean? So if you said, let's say Sarah and I, and you told Sarah, you do not metabolize carbs, but Kitty, you do. What does that actually mean is going on in the body?
So you might be more sensitive. You're not utilizing your carbohydrates as well right off the bat. Your blood glucose is staying a little bit too high. We're not shunting that into your muscles, using that for fuel. So we're going to look at making sure we're doing less refined or like simple sugars, right? Or maybe we're making sure we focus on those complex carbohydrates, but pairing that with a protein. So it's blunting some of that glucose response or high blood sugar spike. And similarly with fats, maybe you don't metabolize fats as well, so you're going to store a lot of those versus using them to fuel your brain, to fuel your body functions. And so you might be somebody that a higher saturated fat or like a full keto diet, you might see cholesterol numbers start spiking. You're going to make more cholesterol, or you're going to reabsorb more of that cholesterol. So you might be somebody I'd say, I don't want you to try full keto and like high fat diet. We want you to decrease this saturated fat or specifically focus on some of these micronutrients. But it's often paired with your biomarkers. We might say you have this predisposition to not metabolize it as well. But right now your cholesterol levels look amazing. Maybe we'll continue to track that. And if your diet changed or you tried something different, we're following that, right? We're checking and rechecking.
I feel like Kitty and I have seen this in practice.
Yes.
And so in lifestyle medicine, even though we're not doing some genetic testing, just doing some of the biomarker testing on people more frequently than we do in traditional medicine, I have been able to see some patients, for instance, their cholesterol respond really well to adjusting different dietary measures or whatnot, and they can completely control it with their diet. versus others that cannot, or patients that you would never think, if you're comparing their lifestyles side by side, that one would have diabetes or prediabetes and the other one didn't, that there's a genetic component there. We see this in practice. Precision medicine has some additional testing to help tease that out as well.
Yeah. I would have patients that were spouses all the time, like they're eating the exact same things at home. Everybody's as dialed in as possible. And somebody has super high cholesterol levels. Somebody doesn't. They're eating good, healthy red meats all the time or healthy fats, but somebody's cholesterol went much higher and somebody's didn't. And then they get to compete at home with who gets to make the different meals.
I've watched Warren CGMs, and she's always blown away of how I would end up with diabetes if I did not really stay on top of it.
She really would. Yeah. Because Sarah eats incredibly healthy, but her sugar is just, it always surprises me.
Yeah.
Yours will go up way more than mine.
Yes. So,
for something.
Being able to have that real life data just knows it's like, I don't have room to play around with.
Yeah, it was the same. I think I probably inherited a good bit of my dad's cardiac genetics. And when I started as a patient myself in precision medicine, had pretty high cholesterol levels, was eating what I thought was these healthier grass-fed red meats and all of this. And I was just very sensitive to saturated fats. So as soon as I cut that way down, tracked that for a while, figured out what I could eat, my cholesterol levels came back at optimal levels. So it was like pretty interesting to see in practice for myself too.
Tell me I'm just curious, what did you change for your protein sources and stuff in order to bring down your saturated fat and your cholesterol?
Yeah, I went mostly toward poultry, a lot of chicken, turkey, more fish, higher omega-3 fish, mostly salmon. Not that I won't ever enjoy some red meat, but it became much less frequent, much to my husband's dismay. I was like, can you buy red meat once this month? That'd be great. I would say those are the most. And dairy's kind of my Achilles heel, so trying to minimize higher fat dairy sources. So doing lower fat Greek yogurt, that would still be like a good protein source for me.
Yeah. I think that's good to bring up because recently and with the new food guidelines and just some of the trends that are out there in health, I feel like everyone's going full fat dairy, a lot more red meat, and I am worried about the saturated fat consumption in our world right now.
Yes. And I think what happens because of social media, we were already like this, but social media has just made it so much worse. There may be an individual who was able to eat in that way and improve their health and improve all their metabolic markers. But that doesn't mean it's going to work for you.
Absolutely.
And so you can make adjustments like that. And it's really important to have someone following some of these parameters so you get that real life data. Is this change improving my health? And so I really think there's a lot of value in people that make dramatic nutritional changes, having someone in healthcare monitoring a lot of these biomarkers to see how you truly respond, because everyone's different. And I think nutrition's very much so is personalized because we are all metabolize things differently and just have different genetics in our risk factors. We just all know that. And then it's not just saturated fat or carbs. It can be salt. We know that with hypertension, like some people are extremely salt sensitive and that drives all their hypertension, and you can reduce their salt and suddenly you solve their hypertension, but there can be someone else that's your neighbor that it has no impact on. Or even caffeine. We all know caffeine. There's those people that can drink caffeine at 4 p.m. and go to bed. And then people like me, if I do that, I'm up till 4 a.m.
Yeah, absolutely.
So,
yeah. And that was some of our genetics testing too. Like are you a fast caffeine metabolizer? Do you have some of those genes that are going to make you more susceptible to that affecting your sleep, or more of the anxious effects from it? And we can definitely get that from trial and error.
Yeah.
I think sometimes it just gives us some of that upfront information, a little less like N of one, retest ourselves, just gets us there.
I think too, sometimes you can be like, oh, maybe it was something else that made me not sleep, or try to reason away what you know is probably the problem because you want to keep doing what it is that you're doing. So I feel like this is really something that could help motivate you to make a change if you know you need to change but not sure exactly what to do, or you feel like you need that extra push to do it. This would help.
For sure. Absolutely. I think, like you said, I think the pillars of health, we're still going back to eating whole foods, eating good foods, but just narrowing that down of what does that specifically look like for you. And the buy-in is pretty crazy when you see, oh, yeah, this is what my blueprint says. Or there's just a lot more ownership, I think, of it and motivation to try the harder thing you were hoping to avoid.
Yeah.
Sometimes. Not always. But sometimes.
You're like, my genes just told me this is
I
the way
know.
it's going to be. And I have to say, this is one thing I find super fascinating with precision medicine is the nutrition. I've seen a lot of it in real world applications and whatnot. But I was unaware of what our genes can tell us about exercise.
Yeah.
Can you explain that one? Because I never knew that I guess some people are better at things than others, but precision medicine can just help you, not just if you're an athlete trying to figure out the best way to work out, but just trying to figure out what's best for your body and keeping it healthy for exercise.
Mm-hmm. Yeah. There's some genetic variants that may say you're set up to maybe not tolerate multiple days in a row of high intensity exercise. So a lot of people like crushing themselves. I'm just not getting in shape, or I'm feeling worse. I feel more inflamed, right? Because they're hitting multiple high intensity workouts a week. It's okay. We might not be genetically just set up for that. Or similarly, people that have genetic variants for slower recovery. Maybe they just get more inflammation with exercise. Some of that we want, right? That's how we're repairing muscle to build muscle and increasing our VO2 max. But if you're getting super high inflammatory levels for multiple days in a row, let's talk about strategically taking rest days. What are we doing on those rest days and how are we recovering? And similar, like even muscle trainability. You might be somebody set up, you're going to do a little bit better with some higher weights and lower rep schemes versus lower weights and a higher rep scheme. So it just, again, helps tailor what's going to help your body do the best it can for as long as we can versus just exercise more. Or are you set up for more endurance type activities, like to tolerate that a little bit better or that lower zone 2 heart rate? And definitely helpful when we compare those with what do you feel like? How are you recovering? But if you can layer in heart rate variability or sleep scores and how are you recovering with that data too, I think that can be a really helpful way to layer in that.
You've mentioned heart rate variability a couple of times. Can you explain to our listeners a little bit about how you use that with patients?
So heart rate variability, it tells us beat to beat how much that can be. We want that to be variable. It gives us an idea of how healthy our autonomic nervous system is, or that like rest and digest part of our nervous system. The higher the variability, the better. And if we're seeing consistently low numbers, give us an idea of how are we not supporting that stress axis system of our body. And so that may look like, okay, we took down your high intensity exercise. We're only going to do 3 of those this week instead of 5 and build in some of that recovery time. Do we see increased variability to suggest you're giving your body time to recover and rest and ramp up for the next time that we challenge it again with higher intensity? Same with things like stress. The more stress we have, that can lower our variability and giving an idea of as we improve that, do we see improvement in variability, heart rate variability, things like sleep. Just, it doesn't dictate everything, but it's a nice trend to track because it just, gives us this marker of kind of that like what gets measured gets managed, right? We can't unsee that our heart rate variability went down with that day of drinking. So we know that's affecting our bodies, and it's just a helpful trend over time versus one day of a heart rate variability being down may not mean much, but over time we're seeing what things are taking it down, what things are bringing it back up.
All the wearables that are out there today track all this information, and I know it will even give you notifications. Hey, your heart rate variability is off. What are you doing?
Yeah, and there's some that are more of like a biofeedback device.
Yes.
So like they see your heart rate variability changing. Maybe you're in a stressful situation. It might give you a little buzz. Hey, check in. Maybe take a deep breath.
I'm going to have to start looking. I have an older Apple Watch, but I think it probably still has that.
I get all my data from my Oura Ring.
Yeah. You're an Oura Ring.
I know. I love my Oura Ring, mostly because it tells me when I'm going to get sick.
Yes.
Which is
Definitely,
crazy to
like,
me.
gives
It's
you a
like,
heads up.
warning. It's like this red, fiery screen that pops up, and it's right every time.
Yes. Yeah.
I'm someone, just for you listeners, I've never done this type of testing before, but I can see how that would be helpful, either if you're a professional athlete trying to optimize that, but even if you're just someone like me who's trying to stay active and fit, you don't have that much time to devote to exercise in your week. So it would really help you optimize those minutes that you do have to make sure you're getting the most out of it.
Yeah. Get the most bang for your buck.
Yeah.
The time you have. For sure.
And tell us a little bit about how this can help people assess their metabolism and their insulin sensitivity. Is the testing giving you much feedback to help people with that?
Yeah, I think we can get some ideas of predisposition, which again, we pair with what is our actual blood work data. And so we know we're predisposed to this, maybe we're going to eat this certain way, or maybe we're starting to see some signs of an elevated fasting insulin or an elevated blood sugar, A1C. There's some data around genetic variants that could say predisposition to increased insulin resistance or diabetes. So you have some of that data. From a biomarker standpoint, mostly doing the fasting insulin, fasting glucose, A1Cs. The vast majority of what I'm doing are those numbers, and then continuous glucose monitoring and seeing how that is affected with whether we change up nutrition or exercise or even timing of nutrition around sleep.
Do you have general thoughts about food timing for everyone, or do you really go by what you're getting back from genetic markers on that?
Yeah, I think most of us are all going to benefit from trying to cut off most of our food intake 2 to 3 hours before bedtime, ideally, right? Like life does not always lend itself to all of that. And I think most of us are going to benefit from like a good 12-hour window overnight of not eating. Obviously, shift work can change that. But I think that's a good general guideline to start with. You have some people that just can eat whenever they want and nothing really changes. So definitely always pairing that with timing. But there are some genetics around glucose tolerance near sleep hours. So if somebody has maybe more variance and we're seeing some insulin resistance, okay, maybe we're going to back this up. Is there a world possible that maybe we're cutting off food like 5 or 6 p.m., something that really gives a lot of time. Maybe we can't do that. Let's incorporate some movement, take a good walk after dinner. Maybe we shift like the bulk of our calories to earlier in the day and dinner's a small meal. So I think that's where it can get a little more tailored per person.
And what about intermittent fasting? Is there any genetic predisposition for people that do better with intermittent fasting, or is that more of a trial and error, or how do you usually guide patients on like those shorter eating window even?
Yeah, I haven't used genetics as much to determine intermittent fasting or not. I think it's been more of like maybe there is a metabolism issue or an insulin resistance issue that we might go down that road more, or that would be the reason we'd start it. The caveat being, I think if there's some cancer risk, like some genes pointing some higher risks, and not like genetic mutations, like they will definitely get cancer, but just like maybe there's some higher risk here with some of these variants, maybe talking to people about incorporating some periodic prolonged fasts. So maybe not like a daily intermittent fasting, but maybe once a quarter, we're going to do a 72-hour fast, something that can increase that autophagy, or where our body cleans up some of those older aging cells can reduce some cancer risk there. I would say that would be the only time I'm thinking of genetics telling me fasting might be a good tool here.
That's interesting, but I didn't know about the genetics telling you need to be not eating closer to bedtime. Because that's, I think, just at least in our lifestyle as Americans, the bulk of our calories come at dinner, and then a lot of people like to have dessert later and things. And we, unlike some other cultures that get the bulk of their calories midday, and that probably is better for them, it's hard to change that habit.
For sure.
But if you had that genetic paper in front of you saying that, I think I'd be more likely to change if I
just
saw
wear
that.
a CGM.
Yeah.
That was like so eye-opening to me when I wore one, and just it didn't matter what I ate. If I ate something right before bed, my glucose would just stay up for hours. It was just so impactful. So I think that even without the genetics, wearing one of those for 2 weeks, that's all it takes, just to see some of the behaviors that you normally do. And you're like, is this impacting me? Yes or no? And then you get that real-time feedback. And it definitely did for me on that one.
Yeah. I think the wearables have been like an even bigger impact there, whether CGM or people seeing like that late meal or like late drink affect their sleep.
Oh, for sure. That's like another one. Is like when you're like looking at your sleep scores and you're like, what did I do? I dropped 20 points.
Yeah, absolutely.
Yeah, it helps me with accountability. I've got a CGM on right now, and it just Sometimes I'm like, oh, don't eat that. And then I'm like, I know if I eat that, I'm going to have to see the
Yeah.
result on my CGM. It can keep me from doing it sometimes.
Speaking of sleep, though, let's talk a
Yes.
little bit about sleep now. What information can you obtain genetically that helps people with their sleep, or is that another one that's more of trial and error, or just taking a good history of understanding how to help people optimize their sleep and master their circadian rhythm?
Definitely a mix. There are, like we talked about, some genetics around like late night glucose tolerance. So you can direct people if they're not super dialed in or tuned in to how their sleep is. And they're like, I'm probably fine. I think that can help guide. These might set you up for some better sleep, right? Like not eating late at night. Or we talked about there's some genetics around caffeine. If you're a slow metabolizer or have some variance around that caffeine affecting your sleep, thinking about, okay, we're going to cut that off between 10 or 12 in the morning. There are some genetics around chronotype, or are you more predisposed to being a night owl or a morning person? They can help direct people if they're, again, if schedule allows, that they can help set up some framework for their sleep hygiene. But a lot of it is incorporating, okay, we're looking at your Oura Ring data. Are we seeing low REM sleep, low deep sleep, incorporating some of that too? Maybe we need to try to back up bedtime. Maybe we need to sleep in a little bit if we can. I think a lot of it's history too. And where is the problem? Is it falling asleep? Is it waking up? Is it not feeling rested? Yeah, incorporating lots of layers there.
Yeah, there's just so much more information that we used to not have for patients to discuss with. But I know these wearables have really just opened up a lot of info to be able to give that real life feedback.
Yeah. And just, I think, brought attention to it. People understand that sleep is important.
Yes.
Yeah, we ignored
Very
sleep.
underrated.
Like 20 years ago, would anyone be talking about sleep as much as we do today? It was almost just like, I don't know, you just get it if you can.
Yeah.
But now we're really trying to help people prioritize and understand how important it is for their overall health, developing chronic diseases. There's just so much data coming out about how sleep impacts our overall health that it's no longer something that we can just push through, but we have to figure out how to prioritize as much as possible.
I'm really curious about, because you mentioned stress a few times and its impact. What do you do as far as information around stress and mental health, and how can you apply that to help people better manage?
I think this is a fascinating area that's continuing to rapidly change and develop. Some of the biggest ones I think I've used with folks is there are some genetic variants around dopamine metabolism and like how we process that in our brain. There's a COMT gene. They often call it like the worrier versus warrior gene. So are you more predisposed to get really high levels of dopamine, that maybe you're initially more resilient against stressful situations, but on the flip side can be more predisposed to like some addictive type behaviors, or more predisposed to get those low dopamine states where maybe you are more prone to anxiety and stress, but can cross into those low dopamine depressive states. That, again, that can give us an idea of predisposition and almost keep a lookout for it if you haven't, or a lot of times it can be confirmatory to people like, oh yeah, that tracks.
Or I came from this comes out a lot. It's like, came from a family of warriors. It's just what we do.
Yeah,
it's probably genetic.
Yeah, for sure. And so having some of that context can be helpful, but also having some genetics around how do we metabolize alcohol? Are we at higher risk for addictive behaviors, or because the way we metabolize it, more prone to getting that dependency, overindulge? Similarly, there's some genetics around like THC and CBD metabolism. And how is that? Again, are you more prone to addictive tendencies there, or there's some around like psychosis symptoms with THC or CBD? And even to the point of how do you metabolize it? And could it, if you wanted to try it, would you be somebody that CBD might be more helpful for sleep versus an anxiety response? And I think another cool thing in this area is there's a lot of pharmacogenomics. So looking at genes that process different, if you were to need some type of medication for anxiety, depression, psychosis, and if you would need that, what do your genes say about maybe what medication would work best for you?
Yeah, I had some experience with that with patients. It was always interesting to me because sometimes I would change their antidepressant based on that genetic metabolism. And sometimes it made all the difference in the world, and sometimes it did not.
Yes.
And I'm like, it's still just so interesting how genes are only part of it. And then there's something else, and we don't always know what that is in order to make something matter for you. I'm particularly curious about people with these addiction tendencies, and you've told them that you have that. Have you seen them be able to put that into action to be helpful?
I would say I've definitely had some people that maybe they saw it in like a family member, and then they see this about themselves. So they were maybe hesitant about it anyway, and it solidified. I'm just not going to play there.
Yeah.
Or some other folks like with THC and the psychosis type symptoms. And oh yeah, I had that. I don't want to go back there. Now I know why. So I think more so from the prevention, I don't really need to start that or continue it, but I haven't had as much experience with it as a treatment option.
And are there any genetics around, like you are someone that mindfulness and meditation would help you, or you're someone that exercise would be a better stress management? Is there anything that's giving that kind of information?
Not that I've used. I'm not saying it does not exist. I feel like we're finding more and more all the time.
With genetics today, it could be next month. Who knows?
Yes, absolutely. Right. Yes. It is like, I might not have read that paper yet when it came out. There's so much to keep up with.
And I did mention poop earlier, but where are we with microbiome testing and actually having relevant information for patients on what that testing can provide? Because I know just a few years ago, that testing really wasn't very solid as of yet. Have we gotten there where it's useful to help with patients, or where does that kind of stand at this point?
Yeah, I think it can be a really helpful tool. I don't often use it as a shotgun approach. We should look at everybody's poop and tweak that. I think definitely with people having either specific symptoms around gut health, it can give us some insight.
Like people that feel bloated all the time.
Yes.
Or something like
yeah,
that.
thank you. So bloating, or I always have like chronic diarrhea, or man, like I just feel terrible after eating. Or maybe it's somebody that they just continue to have super high inflammatory biomarkers, and we can't really find one good option. So maybe we've rolled out X, Y, and Z, and let's see what our gut looks like, because we know we can start a lot of inflammation there. But I think microbiome can be really helpful. And the gist of a specific microbiome test, like we're looking at what kind of bacteria do we have living in our gut? What's the population of the good bacteria or more helpful? We want a bunch of diversity. And so I think it's good at giving us some of those insights and can be helpful in telling us what to add in, like depending on what bacteria we may want to increase or make more diverse. That could include, okay, I want to do different types of plant fibers or a prebiotic fiber to feed the good stuff. Or, okay, we want more of that bacteria that make short chain fatty acids that kind of increase our gut barrier and all of that. So maybe that tells us to add in some more of those. It's hard to check microbiome and say you have to cut out these specific foods. I think we can see patterns of high inflammation, and maybe that points us toward we're going to take out the things that are more likely to be inflammatory, like a gluten or a dairy or soy. So it can point us toward maybe more buy-in for patients that they didn't want to do an elimination diet to see if that helps, but seeing that we have all this inflammation here can be like a helpful measure and then manage. And they can be a helpful like check and recheck, but I think a lot of times we make some small tweaks and people feel a big difference. So I do think it's really helpful for specific situations. I don't think everybody needs to check their poop twice a year or anything like that.
And the testing that you do, we've talked a little bit about at least giving some information about fat and if your cholesterol is more likely to be high from your diet and insulin sensitivity. Are there other chronic disease biomarkers and genetics that you test for regularly?
Yeah, I think the biggest ones are often cardiovascular disease, dementia, and I've done some more well-known variants that can increase cancer risks. But I would say a big bulk of the practice I've done is around cardiovascular disease and dementia, because those are people see their family members struggle with those things. And the biggest one probably being that ApoE4 gene that can increase genetic risk of dementia. I've spent a lot of time talking and counseling and optimizing around folks that have some of those ApoE4 copies.
And for someone who does have that, what information are you providing them or helping them work on to decrease their risk of developing? Because just because you have it doesn't mean you automatically
Absolutely. Correct.
get that condition. But what are some of the highlights that you're really pushing those patients that have that high risk?
A lot of times still take it back to pillars of health. Okay, we want them from a nutrition standpoint. There's some studies around different lifestyle factors that you can implement that kind of brings, every time you add a copy of that ApoE4, so up to 2 copies because you get a copy from each parent, but every time you add ApoE4, it can like exponentially increase your risk of developing dementia. So if we can try to pull that back down toward the baseline population risk, and there are a couple studies that have named some of those heavy hitters, so decreasing saturated fats, increasing omega-3, good healthy fats, again, watching insulin resistance, like decreasing simple sugars, lowering any inflammatory inputs. So if people are smoking, stopping that or never starting, decreasing or completely cutting out alcohol is another big one. Definitely focusing back in on sleep and how that can be like a huge boulder in helping reduce risk there. Good movement. Those would be the biggest ones we talk about from like a initial big lifestyle levers to pull there.
And if you have someone that has some health anxiety, are there any of these things that you hold off on doing? Or how do you go about that? If someone has health anxiety and let's say they found out they have 2 copies of ApoE4, how do you approach those types of patients?
I think there's a couple ways. I think from the upfront aspect of kind of letting people know what you're going to be checking for, because I have had patients that say, I want to know everything except my ApoE4. Maybe they had some knowledge of what that information was, and they're like, I don't want to know. I'm going to be better off without it. You can start there. Full disclosure. What do you want to know? What do you not want to know? And then I think beyond that, definitely always presenting risk with an action plan. And from my standpoint too, again, we're checking those genetic variants and reiterating this is our kind of blueprint and what we might be at increased risk for, but it is not a stamp of fate or your destiny. And so here are the ways we're lucky that we know this information now. We can take it seriously and have an action plan around it. And I think for the most part, the vast majority of people find that empowering, that they have this knowledge and can use that as their lens when they're making lifestyle choices. But yeah, I think always pairing it with what we can do about it can be a helpful one from the health anxiety standpoint, for sure.
And if you are interested in those lifestyle changes around dementia, Sarah and I did an episode back in August about that if you want to learn more about those things too. So just thinking about all of this and all this information you're gathering for people, how much of it, the guidance that you're giving to different patients is just standard and universal for everyone? And how much of it do you feel like is changing based on their results?
Yeah, that's a great question. I think because so much of it does just go back to these pillars of health. And I would venture to say, I bet maybe 75, 80% is just those things, the standard, this is what we all need to be doing on some level. And I think that extra 20, 25% is just refining what that pillar looks like for that individual. These specific micronutrients would help you here, or these specific macronutrients would help you here. So yeah, I think just helping hone in and giving people a starting place, because even those simple things about pillars of health aren't always easy. So I can give people like a starting point.
Yeah, help them prioritize what they need to look at first, because as we always say, you can't change everything at once and be successful with that.
And I know for some patients, and I don't know if you've seen this in practice, I know when I've been asked this question by patients, they feel like precision medicine is going to help them know a lot of different supplements to take in order to be the healthiest version of themselves. But it really sounds like a lot of this testing, again, is just looking at lifestyle more so than adding on more pills. Is that correct?
Yeah, I would say the definite priority is to hone in and optimize as much lifestyle as possible. Might there be some things that, okay, we see that, say from a micronutrient standpoint, like we know, okay, I have several variants around vitamin D metabolism and binding, and my levels are always low. So maybe that hones us in, or again, gives us some buy-in. We're probably going to benefit from some indefinite use of vitamin D, right? So I think there's definitely a layer to that and can help us know what supplements may be helpful. But I think we can get a lot of that from, are we seeing consistent low B12 and folate or low vitamin D? We get some confirmation. It's not just checking it to know, okay, I always need this supplement. I don't think that's as much of a priority as the lifestyle optimization piece.
So if there's someone out there that says, I can't afford to do all of this testing, I think it's somewhat reassuring then to know that the majority of what you need to do is what we're saying in lifestyle medicine, managing these pillars of health and
self-experiments.
Yes.
Yeah,
as
and
well.
then just do it.
Yeah.
Yeah, do these experiments. Yeah, and just see how you feel and pay attention. And you can really figure a lot of these things out.
Absolutely. Yeah.
If you're observant and reflecting regularly.
What are some negatives that you've seen pop up with patients in real life when they've gotten some of this information? Is it just so discouraging that you see patients just not want to do anything? They feel like doomsday? Or most of the time, is it just motivating?
You'll definitely have some folks that maybe we have multiple categories of labs where everything's red. And I think it's the majority of the downside has just been more from like an overwhelm standpoint. And so if you can funnel into here's where we're going to start, and we don't have to do everything at once or all of that, I would say that's been the majority of the downside. Or even, I have an ApoE4 and I have risk of diabetes. I've definitely seen some like shell-shocked folks, but I've never experienced people just like throwing in the towel either.
Do you ever feel like people get false reassurance if their genetics come back, oh, you're lower risk for getting diabetes? Then they're like, all right, bring on the ice cream.
Yeah. No, I think because we've gotten to pair it with their biomarker data too, where it's, these look great, but maybe we have X, Y, or Z. I mean, I think people get a little breath, maybe, okay, like I'm good right now, but encouraging the continued monitoring versus a one point in time.
Are there any areas that you feel are coming up in precision medicine where the evidence scientifically isn't that strong yet that you think will be an area that's really going to change a lot in the next few years?
I feel like any of this kind of polygenic, where you're looking at interplay of multiple genes, I think that we're always continuing to build evidence here because I think the interpretation, there are so many variants that can do so much. So I think that's always a continued field that's being studied. Just even in the things we've talked about, like the sleep and the exercise, there's just always new variant coming out of changing something. I think epigenetics, like looking how we influence our genes and turning them on and off, and our genetic age, or how old is our DNA. I think that's a big, huge area that's just exploding in its implications, and looking at that data and how it's correlating to health span and lifespan. I think that's going to be a continued one to watch that's going to get used, because that one, we may do a one-time DNA testing that's here are your variants, and that doesn't change, but epigenetics does. And it can be another test and retest. Okay, my DNA looks 10 years older, and I cleaned up all this stuff and implemented these lifestyle things and stopped alcohol or smoking, and we're going to recheck. And my DNA looks my chronological age now.
That's
the new
fascinating.
big area.
It is, yeah. And so can people go out and get these tests on their own? When I'm hearing you talk about it, you're integrating a lot of different thoughts when you're counseling patients. You're looking at the genetics, but then also looking at just their history, their family history, their biomarkers, and then making a plan. But can someone just go out and get this on their own and not be getting that advice from a medical professional?
Yeah, there's definitely commercial testing available. And they're going to be accurate in the sense of here are what your variants are. I think the hard part can be the responsible interpretation of them, because they'll give you I can hand you like, here's your report, but to not know, I think you get that overwhelm, like where do I even start? Yeah. And does this actually, because it is, so much of it is a predisposition, right? And maybe we're not seeing evidence of these things at the moment. If you don't have integrating that health history, your biomarkers, all of that.
So you're saying not ideal for health anxiety.
Not ideal, yes.
Go buy a direct-to-consumer test. Do not do that. That's what
So
we're
maybe
saying here for listeners.
Yeah, and I think more and more, like some of these commercial testing, they're starting to integrate maybe a facet where you can pay extra to talk to a provider about these results. So I think that integrating some level of that is always going to be more helpful.
Yeah. I'm imagining in my primary care time, I feel like people would start to come in with things that's probably going to only get more. You're like in there when your 15-minute visit, you have a patient addressing 50 things, and they're going to come in with this report and be like, also, this is my genetic report. What do I do?
Yeah. Yes. I would have that
we
with
feel you,
patients.
PCPs.
Yeah. Patients would ask, can I get a copy of this report to take to my annual? I'm like, you can.
It will take them hours to review it
Like,
all.
I'm going to send this to them so they can look at it beforehand. It's 40 pages.
Yeah.
I'm like, I'm so sorry.
So if you are someone that's interested in this, really just looking for someone that has some experience in precision medicine so that you are interpreting this to not be overwhelmed, but to actually be able to optimize your health, I think would be important.
Absolutely.
To kind of wrap us up, and from everything you've seen from the genes and different patients, what would be the couple things you would tell every person that they should be prioritizing in their life?
I think we get a lot of the eat and exercise. I would say from a lot of my experience in this space, really honing in on sleep and stress reduction and just how underrated or tools for stress resilience and reduction. I know we can't always take all of our stressors away, but I think those two lifestyle levers I've just seen contribute so much to insulin resistance and inflammation and all of that. So I would say the biggest things you could probably do for yourself are sleep, or really hone in on specific sleep issues if that's like continuing to be a hard place for you all. And then just addressing stress and recovery practices, stress lowering practices, I've seen just go a really long way.
I think that's great to hear because
No,
we do
it
spend
is.
so much time talking about eat right and exercise. And
And many times to do all those, people lose the other two pillars. So
Yes.
it's really nice to hear, no, they all matter. Just to get that one more workout in the week, maybe it should be we're resting instead or whatnot. I think a lot of people need to hear that.
Yeah. So take care of your stress, take care of your sleep.
Yes.
And yeah, you've given us so much
Yes.
neat things to think about today. I think it is exciting about where medicine is going to help people that are proactive and want to take a preventive strategy for their health.
And just remember, genetics loads the gun, but lifestyle pulls the
Yes.
trigger.
That's right. All right. Thank you so much, Dr. Jones. And join us next week. We will be talking about how to optimize exercise and have the right mindset to be able to stay active and achieve the lifestyle you want in your later years and what you need to do to get that.
See you next week.